DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. Our guest is Dr. Mike Sanderson from the College of Veterinary Medicine at Kansas State University. We're going to talk about biosecurity and the cow herd. Stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson and we're here at Kansas State University where we have a guest, Dr. Mike Sanderson, who is the Jones Professor of Epidemiology at the College of Veterinary Medicine, and you are in the Department of Diagnostic Medicine and Pathobiology, is that correct?
It is.
All right, great. And Dr. Sanderson has been a colleague and a friend for 2 decades, and he is known throughout the country when it comes to beef epidemiology and beef cattle medicine. Just a tremendous resource on many different topics, but we're going to talk about biosecurity today.
Good, great topic. Thanks for having me, Dan.
Yeah, appreciate you, Mike. And so when we talk about, we're kind of leading off, you said maybe we'd talk about just finding out what kind of diseases you have in the herd.
Well, I think that is important. There's not a lot of point in spending money excluding diseases that you already have. So it's good to have a little bit of an idea what you already have. For example, if BVD is already in the herd, you may want to get rid of it, but spending your money keeping it out when it's already there is of no value.
Right. What are some of the things or disease opportunities that you would be thinking about with that internal assessment?
In order to do that, you need to have some decent records about performance and things, and that will often give you some good clues about what might be going on. At other times, getting some good necropsy data from animals that die, when you have calves that die or anything that's sort of an unexplained death at least, it's good to get your veterinarian out, have a good necropsy done, get some diagnoses so you know what's already in the herd. Certainly, there's some things you can work to get rid of and keep out, other things that they're just everywhere, and you're probably not going to be able to either get rid of them or keep them out.
Right. And there are things that I would assume that's based on how it's transmitted.
It is, and to some extent just how common it is. So IBR, for example, is just everywhere. There's no point in trying to keep IBR out of a herd. But we can't manage it. BVD, on the other hand, is a bad disease, but it's not everywhere, and you can establish a free herd with some careful work.
So we can do things with viruses, some bacteria, or maybe, and then parasites, and all these different levels of understanding of how they impact performance, how they impact reproduction. I guess that's how you start to see it.
I think that's how you start, and then just having a good relationship with your veterinarian so that they can help you understand the differences between those different agents and how they may be introduced, how they may act, and what you can do to control them if you can't get rid of them, or get rid of them if that's possible.
Yeah. So I assume that if you're going to do something with endemic disease or kind of look at what's going on within your herd, there'd be a certain sampling protocol too, if after you identify something, because you wouldn't necessarily have to test them all to start out with, would you?
Right. Yeah, and that's something else that your veterinarian can help you with as far as who you should sample within the herd. There may be particular groups that are more important than others, and then how many do you need to sample in order to get a good estimate of what's really going on.
So if you start to see something like a decreased conception rate, or you have decreased growth rates, or animals not reaching physiological maturity when you think they should, start to look at some of these diseases, work with your veterinarian, because they're going to call somebody like Dr. Sanderson and help.
Yeah.
He's going to help us design a plan.
Yeah, hopefully.
Great. All right, we're going to take a break. When we come back, we're going to talk about how you kind of contain those types of diseases within your herd with Dr. Mike Sanderson.
DNA Dialogue is brought to you by Identity Feeder, powered by Neogen.
Really, we feed cattle and feedlots because we're feeding them high energy diets and we're fattening them. And so we're obviously get other benefits from that, such as taste, tenderness, juiciness of the end product. But what it really comes down to is how much fat can we put on those. And we're not doing it to put on fat on the outside. It's really about the marbling inside the meat itself. But it's difficult to know marbling when the cattle are live. You don't know that until after they're marketed. So what are packers interested in? They're interested in obviously the weight and the amount of pounds that they can also produce in their line. They're interested in red meat yield, which obviously in our grid systems is a premium and discount based on yield grade. 1 and 2 is a premium, yield grade 4 and 5 is generally a discount. And obviously, if you're not familiar, those yield grade 1 and 2 are more red meat yield. Yield grades 4 and 5 are obviously fatter relative to red meat yield. So there's a premium discount on yield grade. And then, of course, there's a premium discount on quality grade. Quality grades are usually discussed as a choice select spread, but that's really low choice compared to select. And there's premiums as you go to upper 2/3 choice, CAB, which would be black-hided and upper 2/3 choice, and then an even larger premium for prime. So what are packers interested in? Weight, yield, and obviously the most marbled beef that they can market, because they get a premium for those end products as well.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Identity Feeder. Identity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Identity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Identity Feeder.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Sanderson. And Dr. Sanderson is a professor in the College of Veterinary Medicine. He is the Jones Professor of Epidemiology. He is in the Department of Diagnostic Medicine and Pathobiology, and we're here in Manhattan talking about cows and diseases and biosecurity.
Great topic.
Absolutely. It's something that we enjoy anyway. Talk to me a little bit about, because one of the things that's intriguing to me is how do we maintain, we have a herd, we have herds or groups within herds. And so how do we help contain disease within herds to not spread it to everybody?
There's a number of things you can try and do. And we talk about something called risk group segregation. So that sounds hard, but it isn't necessarily. We'd like to manage different groups so that if we get disease in one, it doesn't transmit to another. Young calves is a great example in that we'd actually like to manage those as different age groups. So the calves that are born early in the year, we really don't want to have contact with the calves that are born later in the year until, we're out on grass a while. Because those older calves can be the source of infection for the young calves that are much more susceptible to it. So that would be an example of sort of segregating those groups to try and control diarrhea, in this case, transmission within the calf herd.
So if we had something where we're calving year round and we're weaning twice a year, you're going to have cattle from all different types from age groups and weights is just a recipe for disaster.
Yeah, the calves that are young calves in that group at any particular time, less than 6 weeks of age or something, are going to be high risk for whatever else everybody else is spreading around. So you've just sort of always got that group, and unless you can segregate everything into groups of one, it's pretty hard.
Yeah. Any other types of ideas, vaccinations? I'm assuming that if there's a vaccine available, having the appropriate vaccine protocol is important.
Yeah. So vaccines are really important. They rarely provide sterile immunity, probably never. Right. So we can't vaccinate animals and expect that they will never get disease, but if they're good vaccines, they'll decrease clinical signs. They may not have clinical signs at all, and they'll likely decrease the amount of shedding that an animal does so they doesn't expose other animals as much. So as part of an overall plan, vaccines are really valuable and important.
Yep. And I assume that when we start to talk about these diseases based on your geography and what different things are endemic in different parts of the U.S., that working with that veterinarian to understand.
Absolutely. They'll know their practice area around there, and they will also have some inroads to the local diagnostic lab, so they'll have a lot better idea of what are the things we really should be concerned about.
So when we start to think about that, then understanding that what virus or what bacteria you're trying to keep out is important, right? Because you got to know how it's transmitted.
Yep.
So if it's a vector, we're going to focus on controlling the vectors.
Yeah.
Too.
Right. So you have to control that vector, and you can do that with segregation, but it's got to be segregated far enough that it's farther than that vector will fly.
Right.
So that can be challenging.
Yeah. So anyway, any more understanding or ideas on within herd?
Yeah. So, and a couple other things that could just be very helpful is being careful about equipment. So we wouldn't want to clean the pens and then use that loader to feed calves. Those sort of things where we can take manure from the adult cow herd and transfer it to the calves can be a really bad thing.
Cool. Well, some great information. When we come back, we're going to talk about keeping some bad things out of your herd with Dr. Mike Sanderson.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimedabiologicals.com to learn more.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Mike Sanderson, and we're in Manhattan, Kansas, where Dr. Sanderson is the Jones Professor of Epidemiology at the College of Veterinary Medicine at Kansas State University, and we've known each other for over a couple of decades and got to work together, and Dr. Sanderson is one of those that when you have an issue, you know he's going to be there, he's going to help, and he's so responsive, and very thankful for all you've done for veterinary medicine and for the beef industry.
And for you too, Dan.
Yeah, I appreciate it. You know, we've talked about keeping, controlling, finding the disease within our herd, and then while we're getting rid of it, make sure we don't spread it from big cattle to little cattle and all that. But the other side of this is maintaining a herd. If you go to all this work to clean it up, now I want to keep things out.
Yeah.
How do I do that?
Well, that can be challenging. And again, this is a place where having your local veterinarian really get involved and help you with that can be great. Again, as we've talked before, it depends on which pathogen, which virus, bacteria, or otherwise we're talking about. They each act a little bit differently in how they're transmitted and whether or not they may have a carrier state in the animal. And so that changes how you may implement a plan to keep them out. So we could talk about a couple examples. If we take BVD, for example, common problem and can cause some really severe issues. Testing animals can be an effective way to try to control introduction, but you got to be right about who you test and when. So for example, our biggest concern with that is persistently infected animals. And they come in often. You could purchase them as calves, could be a heifer that you purchased, but it could be a heifer that's not persistently infected. She's fine, but the calf within her is persistently infected. So if you tested that heifer, you'd say she's negative, but come calving time, you have a PI in the herd.
The Trojan horse.
So exactly. So you kind of have to get some guidance about who you test and when in order to effectively exclude BVD from a herd.
So then what about quarantine?
So again, that's a great example, and quarantine works really well for diseases that are going to manifest themselves in some manner, and the animal get over it during the period of quarantine, so that you can quarantine them. If they have disease, they get over it, and then you introduce them to the herd. If they're persistently infected in some way, then that may not work. They may harbor that infection throughout the quarantine period and then take it on into the herd. So it sort of depends on the particular disease that you're interested in, how effective quarantine is. You may also quarantine, in the case of BVD, just during the period when you're waiting for test results. Right.
And so, but for a lot of times, especially if you're just looking for PIs.
Right.
But like for transient infection and as we discussed, that can be 17 to 21 days. I'm assuming that's why a lot of quarantines are 30 days long, that most disease processes or viruses are cleared from the body by then?
Right. So that 30 days in some cases would be longer than you need, but just to be sure you don't miss anything, that's a fairly typical. And if they have a carrier state, then no duration is long enough. So we need to do those some other way.
And then lastly, we talked about it on within herd, but I'm assuming that understanding vaccine history of the animals that are coming in and having a processing protocol or a herd health protocol for arrivals is important.
So, and I think that's a great point, because one of the best ways to manage your biosecurity is when you buy from herds who have good herd health programs and good biosecurity themselves, and they'll be much less likely to be infected. If you're interested in Johne's disease, then that's almost the only way to control it. Testing individual animals at entry to the herd for Johne's is almost useless.
Yep.
Buying animals from negative herds is a pretty effective way to keep it out.
Perfect. Communication, get your vet involved. All great advice from Dr. Sanderson. When we come back, we're going to talk about ramping up in case of a foreign animal disease. You're watching DocTalk. We're sure glad you joined us.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertis Test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Sanderson, and we're at Kansas State University where Dr. Sanderson serves in the Department of Diagnostic Medicine and Pathobiology as the Jones Professor of Epidemiology in the College of Veterinary Medicine at K-State. Great show so far. Thank you.
Thank you.
And let's talk a little bit now about, you have done a lot of work with biosecurity and foreign animal disease, specifically foot and mouth disease.
Yeah.
So we talked about some of these little practices we do. Tell me how it would change in the case of a foreign animal disease outbreak.
I tell people this is a part of my work that I do that I hope turns out to be utterly useless, because I hope we never get a foot and mouth disease outbreak.
I'm with you.
But if once that happens, because foot and mouth disease is so infectious, it's so easily transmitted, and because it's such a big deal from a trade standpoint and everything else, the level of biosecurity will have to be elevated dramatically. So the things that you would do here are not everyday practices, and no one's suggesting that producers should do these kind of things. But once FMD's here, then you probably want to be very strict about importing animals. And only from herds that you have reason to believe don't have FMD. Not just you haven't heard, but they have taken some positive steps to decrease the risk that they would be a source for you. So really careful that way as far as imports. And I'd like my sources to be also implementing a really enhanced biosecurity plan.
And when you mean imports?
Yeah, I mean imports from another herd to my herd, not external. So I'd like them to be doing that as well. For within my herd, I want it pretty closed off. I want to be controlling traffic on and off of my premises. Don't let people on that you don't have to. Try to control wildlife contact. That's a pretty big challenge, but I would try to do as much as I could to control wildlife contact.
Because deer
are potential, certainly can get FMD and could transmit it then. So if you're in an area where there isn't any around you, then the deer are probably not a problem, at least not yet. But I would still be very careful. We talk about something called a line of separation, which really is just a line like a moat that you'd put around your farm and control access. Preferably trucks that might come on are going to get washed before they come on, and probably washed before they go off. So we'd like to limit that, and we'd like to set it up so that if we need feed deliveries, we could have the truck stop outside our line of separation. The truck doesn't come across it, so it doesn't contaminate everything, and we auger feed across the the fence or something. We would be doing serious things to try and control any introduction.
I've even seen on some of these swine truck washouts that they have drying units for the trailers that take them to like bake them.
Yeah.
To get hot enough to kill bacteria and viruses.
Yeah, they did that for PED.
Yeah.
And because they had to.
Yeah.
Luckily, we haven't had anything as bad as the swine guys do.
No, just a great show. Thanks for spending time with us.
Thank you, Dan.
And remember, always work with your local veterinarian. And if you want to find out what we do, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. Mike Sanderson, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.